The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone, and thank you so much for joining us today for our webinar on top tools to motivate your home care sales team to success. I know that your time is extremely valuable, but I feel positive that what you learned today will prove to be wise usage of that time. I know we do have most clients on the call today, so when we get to the portion of the call where we're talking about the Most Member Center and materials in the Most program, which you obviously already know about, feel free to drop off the call at that time or use it as a refresher for what's in the Member Center and how to use it. Now for today's presentation, we have put everyone on mute mode, so if you have any questions during the presentation, please feel free to type them into the little chat box you see off to the side of your screen. We will have a question and answer session at the end of the presentation, but feel free to type those questions in throughout the presentation as they come up, and we'll address them at the end. If we happen to miss your question, we will get in touch with you by email or phone to answer that question. Shelley, if you could hit the view screen, and we'll get into the PowerPoint presentation.
Yes, I will. That's a good tip there, Marissa. Sorry, guys. It's I'm my first time here with Marissa doing this, so my mistake there. But there we go, Marissa. There's our beautiful.
Yeah, there we go. Okay. So I am your moderator for today, and I am the managing director, one of two managing directors at CoreCubed, as well as the administrator of the MOST program. I have been working with the MOST program since the beginning. We're celebrating our 10-year anniversary for the MOST program this year, but I've been working with home care marketing since 2005, and I love working with our clients to help them, pardon the expression, but get the most out of the MOST program. Our featured speaker today is, of course, Shelley. And Shelley Womble is the sales champion of CoreCubed and comes to us with heaps and heaps of experience in the home care industry. She is a wonderful educator and trainer for home care sales, home care operations, and we're so glad that she's joined our team at CoreCubed. So, Shelley, I will let you take it away.
Very good. Thank you so much, Marissa. And welcome, everybody, to our presentation today. We're exactly 18 days into 2018, so Happy New Year. And I always like to look at the new year from the marketing and sales perspective and just kind of rejuvenate, have new motivation to deploy new tools into our sales process. It's always a good time of year to assess what you're doing and make some changes in a positive way. So we're going to talk about tools and how that plays into your sales piece. Our home care agencies across the country regularly tell us that they struggle with a simple problem, and that is, how do we explain why clients and referrals should choose to work with us instead of another agency? How do we differentiate for that? How do we stand out from the crowd? And the answers do lie in how we market and how we brand ourselves, how we market ourselves, and particularly through education and how we use the tools to educate folks and to show and demonstrate our expertise and to show our differentiators in our service lines. So people with care needs often look for trusted advisors for recommendations. So it's very important when we're targeting our referral sources and talking to our referral sources in the community who may send us clients, it's important to establish our agency as an expert resource on aging care issues. And of course, we want to stay top of mind. And so having collaterals are very important, and making sure that they are standout kinds of information and collaterals, because we're competing in a market full of a lot of different agencies, most of us in our communities. And so it's become a very busy place to be. And so we want to stand out, and we want to truly be able to show why they should choose us. So one way to establish your agency as an expert resource is to create your tools that your referral sources can use with their clients and their patients and the families. And they can use these tools to answer questions or to help their families deal with certain chronic illnesses. And so if you're able to create tools and collaterals to give out that make sense to do that, then you can see that most people, that would be a great tool that someone would keep, and therefore your agency would stay top of mind. So developing an online and an offline library of educational materials and sharing them with your referral sources and your families and your community is a huge strategy as it relates to sales and marketing efforts. Okay. So we're going to talk just a minute about print materials versus online materials. So we all know, and I'm sure that all of you on the call have websites and have strategies related to SEO, search engine optimization, and we have, we know we're found quite often if we are doing a good job with those things in the digital space, because more and more online is sort of the old-fashioned version of the yellow pages, but better. So we live in this digital age, and we have spent time and money, I hope, on creating collaterals and education materials that bode well for you in those digital channels. But it's important to also have print materials because digital doesn't reach everyone, and we still have families and the elderly who may not be as digitally savvy, and it's important for us to still continue to have the things we need in professional print materials that can help our home care salespeople bring something of value when they go out and do their sales calls with their referral targets. So they need to be very professionally branded, by the way. So I think we're living sort of this Pinterest DIY age right now, do it yourself. But really it pays to have an expert company such as our group here at Core Cubed to help you with those things, because really you want to make sure your branding and so forth is very professional. And most companies still utilize branded, targeted, engaging postcards, and that's a great way to kind of break the ice and introduce your agency to new referral sources. Having educational rack cards, resource flyers, and that are branded for your agency are excellent ways to have handouts and for them to be able to give them to their clients. Another really good, important thing to consider when you're doing these and making sure they're professionally done, for those of you that have a sales role or are familiar with the sales process in our industry, you know that there'll be places you go and you'll go in and they'll say, certainly we'll take your brochures. And then they go into the resource area where your brochure is going to go with every other company's brochure on the rack, which is great. You want to be there. You still want to be in the resource area for these places. But imagine you do want to stand out in that arena. And to do that, you want to make sure you have very professional collaterals to do that. So a lot of times we encounter agencies that say, "Oh, we have educational materials," and you hear me use the word collaterals. So collaterals could be your brochure, your business card. It could be your educational materials. It's more of an umbrella term I usually use to refer to all of those things. But there really is a difference between having an educational piece versus having a more of a advertisement that tells your services. So here's a simple test you can do to kind of determine, do my collaterals really, do I have both? Do I have both things that help identify who I am and that stand out nicely? And do I have educational materials? So if you have a collateral and you think about, if you removed every piece of, remove anything related to your agency, your services, your name, your product, anything, what's left? Is there anything left if you're not talking about I provide homemaker services and we have quality companionship services. If you removed all those things, what's left? And if nothing's left, then you really don't have an educational piece. So you can kind of see here from our slide, this is a really good example of more of an educational piece, right? So we're talking, this is directed to people who, it says geriatric failure to thrive, some home care solutions. So you can kind of take a look at this, and you can kind of see that this would be maybe a good collateral. Educational materials need to be useful whether or not the client chooses your agency. So one of the other objections we hear a lot, or when we say, okay, what's your biggest sales problem? I hear, getting past the gatekeeper, that's the hardest thing to do. But if you have educational materials, it makes it a lot easier to get past the gatekeeper, to get into the right people, and to be a helpful resource to them, one that's welcomed because you have something to offer. And it's not just, coming in to again, explain what services you provide. So salespeople in our industry, they don't really want to feel like salespeople. It's kind of a, you rarely see people in our industry with that title, salespeople, or salesperson or sales rep. You hear like account rep, you hear community liaison, you hear marketing director, things like that. So we know that sales sometimes isn't really a comfortable place, or at least the vision of what people think sales are. So you'd really want to be thought of as promoters or helpful services or educators. So if you approach sales as being a helpful agency, you're offering helpful information, it makes the job of going in and promoting your services a lot easier, and it really adds this credibility and expertise to what you do and what they may perceive that you do. So I always recommend, like during initial meetings, when you go in for your very first sales call with somebody you have not met before, maybe you met them at a lead generating networking business meeting, and then you schedule a time to come visit them. And your first initial meeting, you really shouldn't bring a lot of things with you. You want to be able to have some ability to come back and have reason to come back. So I always recommend, having a business card and bringing your business card and maybe leaving a brochure. And after the call, it's always really wise to send a personal note, handwritten note, referring to your meeting and talking to them about relevant things that you talked about within the meeting. So that first initial meeting should be one where you're going in and you're trying to learn about them and how their office works, and how do they engage their patients, and what does their process look like, and with the intention, clear intention that you've told them you want to be able to partner with them in the community. And so having those introductory collaterals are great. And then what happens is when you go back and get in front of them, it's good to have the educational materials, to have additional things to be in front of them, permission to be in front of them. Then they're helpful. So a lot of places we go, we call on, the referral sources have lists of recommended agencies who they always refer, and sometimes it's easy to get on those lists, sometimes it's not. But whether you're on the list or not, having some solid educational materials that resonate with their customer base can serve as a great workaround for that list and could land you a position on the list because you're providing these top of mind materials. So for instance, this is one of my favorite ones inside the MOST program. So it's a hospital preparation booklet. And this is designed for hospitals to give to families and to patients so that they kind of understand what's going to happen next when they go home from the hospital. So it doesn't say we do, hire a home care agency XYZ and we have companions. It has, it's branded for your agency, so it's top of mind, but here you are giving some very good information and it becomes a useful tool. So the other nice thing about having these collaterals and having permission to give them and leave them at with your referral sources is that it will end up in the hands of not just potential clients, but other employees who are there. So if you in a hospital, obviously there's so many people that work in hospitals and may interact with families and patients and have the ability to make recommendations if they're asked, hey, I don't know what to do when I get home. What am I going to do when I go home? So these, having these collaterals so they can see you're top of mind, your brand is there. Other people touch these collaterals along the way and bring your agency top of mind. If your materials are meaningful resources, they will land in the right hands. And I think, brochures are great when somebody says, I need their phone number. I need to call an agency. I've chosen this agency, or I think I want to go with this agency, so I need their information to call them. But these things will stay with them. These things will be the things that they keep at their, bedside or, in their drawer, and they're going to, it's going to be their resource that they need to utilize. So a lot of times we see, once you go out there and you meet your client for the first time, your referral source for the first time, and you've maybe they're very open to you coming in, and they take your information. But again, when you're providing them some meaningful materials to distribute, this one is another one that I really like that I know we do at the most programs. So chronic disease management is really key right now inside of our hospitals. Obviously, we have rules around readmissions in hospitals for certain diagnoses, and hospitals can get penalized if they have patients come back into the hospital after having a stay at the hospital with certain diagnoses. So these like if your agency is able to give these tip sheets out, and better yet, train your caregivers to even use these tools as well to help maintain things like how to know if there's pay attention if there's a pneumonia issue that needs attention from the doctor. So there's these very well written educational pieces that aren't complicated that helps families to know how to manage and keep people in compliance when they get home with these different programs. So if you're able to provide these kinds of tools, the hospital will see you as part of the continuum of their care in a very, it'll help them meet the goals of not having that patient come back into the hospital. So when you go back out and you have second and third and fourth meetings, you have to really remember the conversations you had at the initial meetings and understand that process of learning about how the hospital patients flow through the system and who touches the patient where. If you know all those things and you vetted that through your initial sales calls, then your subsequent meetings and the materials you bring to the subsequent meetings should make sense with the discussion you had. So if you learned at the hospital meeting that they are trying to reduce their readmissions and they're really having a problem with people coming back in who have COPD, for instance, then you'd want to focus on that and bring that tip sheet back. You want to bring back things that you talked about that make sense and are relevant. So even when you're using these materials, you don't just want to willy-nilly just bring any educational piece in. It needs to make sense with the referral base you've talked to. Okay. So, when you also use these educational materials and put them on your website, it's really important, as we all know, for that our website has to start with a brand strategy, and it needs to make sense to what we do. You need to know who you are and what your mission is before you can put words up on a page. I see a lot of websites that are not well done, don't really tell me what's different about this person or this agency. It doesn't really tell me, why I want to hire them, or if they say the same things. I mean, if you go to every website in home care and they say the exact same things, then it's a commodity. Then you're just comparing. Maybe you're just going to find out who's available and who's not available, and that's how you choose. But that's not what you want. You want to be able to stand out for what makes you what defines your quality. So you put these words down in a logical, easy to follow format on each page. You want to make sure that you have expertly sourced and written content that can educate your audience on issues that matter to them and their families. It needs to be relevant. Needs to be fresh content, and you need to ensure that you have expertise in the area of search engine optimization, SEO, so that Google will find your site when people are searching for your services. This changes a lot too. Some of the algorithms that Google uses changes, and so it's really great to have a firm that helps you to navigate that so that your website is leveraged appropriately in the digital space. Okay. So we're going to talk a little bit about do's and don'ts of getting into your referral sources. I know I've mentioned a couple things already, but when you are visiting ACOs, so ACOs are accountable care organizations, which is a relatively new term over the last, maybe 10 years. You encounter these organizations within your communities, and they actually don't all look the same. They all maybe, depending on the state or the city you're in, they may have a different structure. But really, the ACOs come about because they're going to help manage. It's really in like the patient care-centered world. How do we, from a how do we manage that patient through a chronic illness? Because so many different things in the community are going to touch that person in that continuum of care. So for ACOs, chronic disease management is the critical piece to achieving their savings. So basically, they make money when they save money by being efficient and using the right resources for this patient. Referring back to some of those educational materials that were on a previous slide that showed how you can manage COPD and so forth, having those educational print materials available for the ACOs and going to talk to the ACOs or the members of the accountable care organization to show your agency, whether you do home health or you do home health and private duty, or if you just do private duty, even non-medical, the non-medical space is still part of that continuum of care, and you provide a valuable link into this continuum of care, because you can help with compliance, patient day-to-day compliance with people who suffer from heart disease, diabetes, COPD, and more. And so your materials need to kind of show that, and this is where this becomes so valuable. So in terms of dues, make sure you continue to stay in communication with your target in meaningful and constructive ways that are mutually beneficial and not one-sided. So that's really important. Again, bringing collaterals that make sense to conversations you've had with them, following up with your new tips and tools for their clients that are educational, and that referral will be, find very, very useful. It's good also if you have a real solid company newsletter and you use that to stay in touch too and provide some educational materials. But I would say we are becoming so much of a digital space that I think a lot of people are starting to get really, barraged with these things. It's important we do that, and people that have some people really look forward and enjoy the pieces that are in there, and they can read them at their leisure. However, because they are inundated, that just kind of goes back to the point that having your print materials and things that can be that puts your representative from your agency out in the community and being face-to-face, I always call that feet on the street, is really critical to have both those things happening. So take time again to mention this earlier, to handwrite personal notes on your branded note cards to acknowledge things like a work anniversary, a birthday, or a personal challenge or target. Maybe one of your referral sources has shared with you, that they have a son who just, graduated from college, and you're very excited about that. Maybe they lost a bunch of weight, and you want to just acknowledge, hey, I see that you've been doing a really good job. Congratulations on your meeting your goals. So this demonstrates that you are paying attention, that this is a mutual relationship. It demonstrates thoughtfulness and in a meaningful way. It helps strengthen your relationship. And honestly, it's way better than just bringing brownies and donuts every time you go in, which I actually felt like on the receiving end, I always felt suspicious of people that just kept bringing me gifts, but gifts are appropriate during the holidays or during a special occasion. But I think the handwritten notes and those things that really talk to how you've personalized that relationship go far, way far, further than brownies. All right, so here's some more don'ts, and I think the brownies are on the don'ts list. Don't just bring and drop off your agency brochures. If your only reason for visiting a referral target is to bring more of the same sales literature like you did last time, it's not a good enough reason. It's not new information. It's not helpful. Unless they call you and say, hey, I'm out of brochures, can you bring brochures? That's the only exception to that. And that's a great thing. I always loved it if a referral source called me and said they were out of brochures, because that told me they really were engaged with the process and knew, like they really did legitimately take those brochures with the intention of helping to send referrals my way. But make sure that other than those circumstances, you want to bring in different educational materials to have permission to take up their time to come see them. Otherwise, they'll avoid you. That's where people say, oh, I can't get in with the gatekeeper, which they're saying, what you hear often. It's because they already know what you're going to say, they think, and you haven't been compelling enough to earn their attention. So don't shower your target with gifts and brownies, tchotchkes, and cleverly messaged marketing gimmicks. Save those things, as we said, for meaningful opportunities to thank them for referrals or during the holidays, or some other, if you're going to have a big event or something, and that you're going to be taking, something in. It's fun to do those things, but it can really sort of take away from what you're really trying to do in terms of the sales. So I have gone on and on here about all these different, I could talk all day about this topic, honestly. And but I am going to be quiet and turn this over to Marissa, so she can talk to you a little bit about the MOST program, which I'm going to tell you, before I joined Core Cubed this year, I worked, as some of you know, in home care for 26 years. This will be my 27th year in the industry, and I wish you so many times. I wish the company I work for, I tried to get them to engage the MOST program at one point, because it was, to me, as a salesperson, if I had this, I would have had, I feel like, all the ammunition I ever needed in order to form those relationships. So it's really, genuinely, I feel strongly about the tools we have in our bucket. So, Marissa?
Thank you so much, Shelley. The MOST program is really going to help you implement all of these ideas that Shelley has been talking about. If you're looking at all of the ideas that she was talking about and you're thinking, there's no way that I'm going to have the time or the money to create all of these different materials, that's why we designed the MOST program. As Marilee Orsini likes to explain it, when we started helping home care agencies market their businesses many years ago, it was with this strategy in mind of marketing through education, but we quickly realized that a lot of home care agencies couldn't afford to do all of this. And creating the MOST program helped agencies to be able to have high quality marketing materials, lots of different marketing materials to compete with the sophisticated agencies, if you will. So what is MOST in a nutshell? It is an affordable marketing system for home care agencies of any size, whether you're new, whether you've been in business for 20 years, whether you've got one salesperson or no salesperson. The MOST program is adaptable for any strategy, any size agency. And the materials are all branded for your agency. You make choices for marketing materials on a monthly basis, and they are completed and delivered to you on a monthly basis. And all of the materials are not just random. They were developed with strategy in mind, an understanding of the home care industry, where it's been and where it's going in the future, because there's been a lot of changes, and of course there will continue to be a lot of changes, and the MOST program has grown throughout the years with those changes. Why do we, well, before we talk about why we recommend it, I want to go through how that program works on a monthly basis, because a lot of clients say, okay, it's a monthly membership program, but how does it work? Well, it starts with a strategy, developing a strategy that's specific to your agency's strengths and weaknesses, who your referral source targets are, and how are you going to best reach them. If you are nervous or unsure about creating your own marketing strategy, we can help you with that. Once you have that strategy in place, then going into the MOST Member Center on a monthly basis is going to be a lot easier, because there are hundreds of different choices for marketing materials and services. And if you have that strategy, then you will know which section and which areas to go to. So each month, about the beginning of the month, our clients go into an online member center. It's sort of like an Amazon.com of home care marketing, if you will. They make their selections by putting them into a shopping cart and hitting submit. And then those materials are branded for the clients during the month. You get a chance to proof them, request edits to them. You also get a chance anytime you'd like, honestly, to attend educational webinars. We have a webinar library that is exclusive to MOST members, where we've had wonderful experts come and speak to us, and all of those are archived for our clients to take a look at. I know some of our clients have sent their salespeople to that webinar library specifically to train them in home care marketing and home care sales. And at the end of every month, all of your materials are ready for you. It's a breeze. I mean, you make your selections. It takes about 5 minutes. We do all the work for you. If you've ordered website materials, we'll post them for you. If you've ordered blogs, we'll put them up. We'll post your social media that you've ordered, have your PowerPoints all ready for you. We'll get your print materials to your printer. So we kind of take all of that busy work out of the equation for you. So each month you get a new set of wonderful marketing materials for your website or for your library of print materials for those referral source visits. I want to go into a little bit of the benefits if you follow the program. And I say that if you follow the program because we know how you're going to get the most out of the MOST program, how it's going to benefit you the most. Some clients go into it with, I just want this tiny little piece, and then they wonder why their marketing isn't growing as big as they'd like it to. It really does take that integrated strategy to grow your business exponentially. And you really will see more referrals from more sources, more client referrals. They're going to recognize your name in the community, and they're going to value your brand because you're going to be seen as an expert in the community on a lot of care questions, not just on providing care, but on answering their questions and being helpful to them. That helps build that trust in your organization as one that really wants to help the community and not just say that you do, but actually physically help them. Why do we recommend MOST? Well, we've been offering it for just a smidge over 10 years now, and I have seen so many agencies grow their businesses from agencies that only had Medicaid referrals and they really wanted to increase their private duty, which is sometimes, it can be a daunting task to get there. And the MOST program has helped so many agencies do that. I've seen startup agencies that have really bit the bullet on, paying those initial costs for MOST, but then have seen them grow so much that they look back and say it's the best investment that they ever made. It really does make sense and save sense, I always like to say, because it's going to save you time so that you can go out there and build your business with the referral sources, your sales team is going to love all of the new materials that they go out there with, because a lot of people are shy of going out there and selling. I don't know how to sell. I'm not a good salesperson. But if you turn it into being a resource and being helpful, suddenly it makes the job so much easier, and the referrals will start coming in. And we do have a lot of awards that we've won for the most program and for the materials in the most program, so you don't have to just take my word for it. I think we have a slide with several of our award logos on it. I think the largest award that we won was for the most program as a whole. We were a winner of a Stevie Award. Runner-up, I think, to the first place, we got a silver award. The gold was one of the biggest marketing agencies in the world, so not a shabby award to win. You've been seeing some of the things that you'll find in the Most Member Center throughout the first part of the presentation, but you can see a longer list here. I always like to tell people basically any sort of marketing material for a home care agency that you could think of, plus a whole lot that you never in a million years could have thought of, it's going to be in the Most Member Center. I have clients that sometimes come to me and they say, do you have something for XYZ? Yes, I do. I challenge, if there's any Most clients still on this call, I challenge you to find something in the Most program that we don't have, because I bet I could find it in the Most program for you. So whether you're looking for postcards or rack cards, brochures, flyers, materials for your website, social media ads, recruitment materials. Don't forget the recruitment and retention, which is super important, especially in today's day and age where everyone is fighting tooth and nail for the best caregivers. It's all in the Most Member Center for you to choose from. So that's why I say that it's important to have that strategy so that you can go into the Member Center with a definite idea of what you're going to be ordering to fit in with who you're targeting. I think right now we're going to do the tricky little dance of switching the screen over to me so that I can show you actually inside the Most Member Center, as well as some further examples.
I think I can do this. I think I can. I think I can. Here it comes, Marissa.
All right. Can you see my screen, Shelley?
Yep.
Excellent. All right. So we saw a lot of examples of different print materials, but if you wanted to see more of them, I just wanted to point you to the Most for Your Marketing website, and then on the home page, just scroll down to sample our work, and you can see some more of our portfolio there of our print materials. But I wanted to right now specifically show you some of the online materials because we haven't necessarily taken a look at some of those, and it's nice to see how they work. So back in 10 years ago when we started the Most program, there was one set strategy that we used for most clients, and that was sending a postcard to referral sources that directed them to view more information about that topic on their website. So they'd go to the website and then they'd see a banner that matched the postcard. They click the banner, get further information about that program. As time has gone on, we've gotten a little more sophisticated where we have options to put in your contact information so you're capturing leads as well before they get that downloadable material. And then also during that month, they had lots of other different materials that matched the theme of the postcard and the banner and the website materials. So they'd get a PowerPoint presentation they could do in the community on that topic. They'd get a press release that they could send out to local newspapers on the topic, and they'd get an e-newsletter on aging care issues that they could send out. So they were really saturating with different types of marketing channels because not everybody is going to pay attention to just the postcard. Not everyone's going to pay attention to or attend the PowerPoint presentation. But this way they were reaching as many people as they want with a united effort of that common theme. And then the next month they would order materials for a different theme. So let's show you one more example of some website resources. So this client has the banner on their homepage. It goes over to the material instead of going to fill out your contact information. Some clients choose to have that. And then you build up a library of resources on your website, which is great for SEO, of course. All of this information is searchable, so when people have care questions, they're going to find the answers on your site versus a competitor's site. And we tailor how we place these materials on your website based on, what your website structure is. So your resource page may not look just like this. It will, this client has a totally different resource page. So we will definitely work with whatever website that you have. I wanted to show you a few examples also of our e-newsletters. They are the most popular item in the Most Member Center because it's an easy, low-cost way to touch everybody in your contact database, and you can see how effective it is because you can see how many people have opened it, what articles they're clicking on. So it's a great way to track your marketing as well. We've taken it a step further by having the newsletters help your SEO as well by having the articles link to your website. So if somebody wanted to read a full article, the article is posted as a blog on the website. And additionally, we do a social media post for you so people can link over to the blog from your social media. So it's sort of a triple threat offering of newsletter, blog, and social media content. Some of our clients opt to have the version of the newsletter that just has the full articles right in the e-newsletter. Maybe they don't have a blog page or they want to do different blogs. So that is an option as well. And you can customize the newsletters with articles of your own, maybe a caregiver of the month, anything like that. And that's a good point to make about anything in the Most Member Center. If you see text on there that you want to tweak or change, when you order it, you can say, hey, can we change this content? And absolutely you can. One last thing before I go into the Member Center, I wanted to show you some of our Facebook ads. Facebook has proven to be a wonderful resource to get consumers to notice your business. It's definitely your target market. As my 14-year-old daughter likes to say, Mom, Facebook is for old people. And when she says old, she means me. I'm in my 40s, so that's pretty close to your target market of adult children who may be making care decisions for their parents. And of course, this advertisement is meant to grab people's attention, and then there's text that goes with it. Here's another example of a Facebook ad. And they're branded for your agency, of course. All right, so now let's jump into the Most Member Center. Everyone's been waiting for, probably. Or not. I just get really excited.
I'm ready.
Because I love this Most Member Center. I love watching agencies succeed by ordering these materials. So because there is so many different choices, we have sections across the top which help you find what you're looking for. If you have a particular referral target that you're looking for, we've got the list of referral targets that we have most materials for listed here. And let's say you want to get materials to target hospital contacts, you just hit read more, and then you can see all of the different materials that we have available, RAT cards and PowerPoints and note cards and on and on and on. And you can see links here to view any of these designs. Let's go ahead and click one of these so you can see. So you can actually view the full item here. You can read all of the text and make sure that this is something that you want to order. You can see that there's different photo options. Most of our material has different photo options to choose because not everybody has the same consumer market, so we wanted to offer choices for you. If you say, yep, that's something that I want to order, let's go ahead and order it. You just hit click to order. And then you can see the price here. The design options, you can see, well, I want to send this to referral sources, not consumers, so I'm going to hit referral. and then your photo choices will load. You just make your choices for the piece. And then you let us know, for this actual item, you have 3 different choices for how you want it designed. Let's say we want this as a postcard. If you have text edits, you would hit yes. If you don't, you hit no, and you hit submit. So super easy, just like ordering something online. You can see a run through of what you've placed in your shopping cart so far. And then you can see which months that you're ordering the materials for. This is probably a good time to mention that our clients order materials a month ahead of when they need them. So right now, January, we're in the middle of working on February materials. That way, by the end of January, everything you order for February will be ready to go. And that's it as far as ordering. It's super, super easy. But let's say you wanted to order something by category. For example, I know I want to order that newsletter each month. You just go to our categories, and then you can see all the different types of categories that we have for material, and you can see the newsletter here. If you have operational things that you want to order materials for, let's say you want to build up your caregiver training, you just come to the operations tab, and you can see all of the different material we have for caregiver training. So I hope that gives you sort of a brief overview of how the Most Member Center works, all of the different choices that you have available in the Most Member Center. I'm going to go change the presenter back to Shelley so that we can go back to the PowerPoint presentation, because there's a couple of more things that I want to go over with the Most program for you. So give us just 1 second as we switch. Oh, that's Shelley's dog.
Yes. Uh-oh. Yeah, I took the screen back, and there you can see Stuart there. Okay, here we go, Marissa.
All right, perfect. Now this is important to show you because the Most program is so special that we want to try our best to make it so that the same company is not handing the exact same material to the exact same referral sources. So we have only offered the Most program to a limited number of agencies in a particular area, and all of the places where you see purple squares are areas where we currently have Most members. If you see your area lit up as purple and you're interested in the Most program, you can still contact us and see if we can get you into the Most program. At the very least, we can put you on a waiting list. And if you don't see your area lit up and you're interested in the Most program, certainly contact us as soon as possible and we'll secure your area for you. It's important to secure your area because we do have clients that stay with the Most program for a long time, as you can see from these statistics. They enjoy it. We have a couple of clients that have been with us for the whole haul, all 10 years. And you can see that 55% are still with us after 1.5 years and 20% are still with us after 4.5 years. So I think that speaks pretty loud and clear for how people enjoy the Most program. Pricing. The Most program is $1,000 a month with a 6-month commitment if you'd like full access to the Most Member Center with your own username and password and making your own selections. Or we created the 3-month commitment specifically for startups because you do not get full access to the Member Center. So you can order anything you'd like in the Most Member Center, but all purchases are made through meetings with me, and we'll walk you through making selections that fit your marketing strategy. It's a great program for startups because a lot of times they don't have anything other than their agency brochure to go out and start building relationships with referral sources. And that 3 months will give you some great collateral materials to get the ball rolling, so to speak. We're very flexible in how you use those monthly dollars. You could see in the Most Member Center a couple of price points, like that brochure or the postcard was $300. So that would cut out of your $1,000. It's your $1,000, think of it like a retainer. And the items that you order in the Most program add up to that retainer amount. But if you want to use some of those dollars for a custom piece, maybe you want us to design a custom advertisement for you, for example, you can certainly do that. Or if you want to use some of your, save some of your most dollars for use in a future month, you can certainly do that as well. I like to, some of you may be looking at that $1,000 a month and gulping at this point, but if you think of it in terms of how much money it would take to create those materials from scratch, for example, a brochure design would cost you over $1,000, and here you're getting a brochure for $300. Not to mention the time that you save in creating that. Time is money. You got to think about that as well. So just a few things for you to chew on, so to speak. And we do have some testimonials that I wanted to show you on the screen. While you're perusing those testimonials, I'm also going to open it up to questions that we can answer. So if you have any questions, feel free to type them in to that little chat box you see on the side, and we'll answer those. And I do see one question in there already. Can you give an example of an ACO?
Yes, I'll talk about that, Marissa. So ACOs, so they're common to that. Usually they're named within the community that they're formed, and they all look a little different. And there's a couple places you can go to see if there's any ACOs in your area. So I know CMS, the government website CMS, has some information about ACOs that they have helped to become part of. But the definition, they're defined as a group of healthcare providers who agree to take on a shared responsibility for the care of a defined population of patients while assuring active management of both the quality and cost of the care. So it typically starts, it's as I mentioned earlier too, in this website I'm reading from says, it is, it's based on the concept of patient-centered care around the patient. So a lot of times it starts with physician groups, but the only way an ACO works is if it's, it usually will include a physician group, a hospital, insurance company. So Kaiser Permanente is a ACO in the out west. So you have to you can Google where are ACOs in my state, my community. You can also go to CMS to see which systems have developed sort of an integrated patient-centered system. And then that just means that the patient is owned and it's navigated through all these things. And even if you're, like I mentioned earlier, even if you're a non-medical agency, it's very, very important if you can meet with any ACOs that operate in your territory, because the concept of compliance does 100% certainly reside in our wheelhouse. As you guys know, if you're in there daily, you're the ones making sure they're taking their medications, that their meals are and their nutrition needs are being met, and that you also know if they're not going to the doctor. You also know if they're not taking their medicine. You know the things that they maybe are doing that are not compliant. So we're really a key part of that. And so I hope that answered your question about the ACOs.
Thank you, Shelley. Another question is the printing included in the price of the most material? And it is not. That is so that you can order through your own printer if you'd like. Sometimes people want to do a short run of just 50 brochures to test them out and see how well they do before they make a commitment of ordering 500 or so. And this allows you to do that. You can print and reprint the materials that you've ordered in the Most Member Center as many times as you want. And even if you no longer are a Most Member, those materials are yours to keep. So we won't take anything off of your website after you leave the Most program or say you can't reprint materials that you've ordered already. So I think that's important to let you know. Anyone have any other questions? If you think of any questions after the presentation, you can see our contact information up on the screen here. We'd be happy to answer those questions, or if you'd like your own private tour with me of the Most Member Center, I'd be happy to set up an appointment with you for that. Just give us a holler by email or phone.
Also, Marissa, before we go, maybe I could just do a quick plug for, I'm offering some online training through CoreCubes next week. I have some inquiry management training and some other sales related trainings offered. If you are interested in taking a look at those trainings, you can go to the CoreCubes website and it's under the Learn section. And hopefully somebody in the group will be interested in doing that. Looking forward to it.
Excellent. Thank you, Shelley. And thank you very much, everybody, for joining us today for our presentation. It's been a pleasure, and we hope to hear from you soon.
Thank you, everybody.
Bye-bye.
Bye.